Hi, so today I would like to kind of cover a topic that sometimes a lot of people that are not physical therapists might get confused about, and this is common misconceptions about how back pain should be handled in the medical world. Okay, so my name is Dr. Brad Conder. I'm the owner of Focus Physical On-Site Focus Physical Therapy, and we contract with employers to kind of help them keep their employees safe, manage all kind of musculoskeletal issues. And we got multiple programs to be able to do that. So back pain. A lot of times there's a misconception in back pain is first of all how this happens. Oftentimes back pain happens more likely due to posture and repetition as opposed to big lifting issues. Now someone might kind of complain about a lifting issue of what kind of brought the pain on, but oftentimes they were having pain before that, they were having tightness before that, and they're not really exactly sure what caused the problem. Because most likely it was a postural issue that's building up over time, and employees really don't know what to do about that. Some other misconceptions are what you do about your back pain. So a lot of times I have employees ask me, well, my back really, really hurts. I need to get an MRI. And so one of the things I tell them is like, why? Why do you need an MRI? A lot of people don't know that MRIs are only meant to really rule out serious pathology. They're not meant to give you a diagnosis. They're not meant to be able to put you off work. They're not meant to kind of really actually do anything that, or as far as medical treatment. They're meant to rule out serious pathology. So when it comes to back pain, unless you have weakness in your lower extremities like your ankles or have even kind of like nerve issues, a lot of times they're not going to do an MRI, and a lot of times it's not needed. So if you go to a neurosurgeon, if you don't have any weakness in your feet, even without an MRI, they're not going to consider surgery. They're not going to consider injections. So what are you left with as far as your actual treatment? And that's what people are really looking for is they have a complaint, and when they're asking for things like an MRI or X-ray, they're really just scared. They don't really know what's going on. They need reassurance from someone like us to kind of really know what it is, tell them about it, educate them about it, kind of decrease that fear, and know what actual good treatment is. So the last thing I want to talk about is kind of what actual good treatment for low back pain would look like. So low back pain in the presence of not having any leg pain, which even with leg pain, a lot of the treatment protocols are the same. X-ray and MRI are not indicated. Oftentimes medication wise, even a doctor, all they're going to kind of suggest is usually over-the-counter medications like ibuprofen or naproxen. Now we're not medical doctors, so take that with a grain of salt as far as like what medications will be given to you, but a lot of times people manage that well on their own because they're not going to give out pain medicines anymore, and even muscle relaxers aren't shown to be great help with that. And then from a treatment standpoint, movement is needed actually, not rest. Learning how to do the proper stretches, making sure to use ice and heat correctly. And then lastly, physical therapy is usually the option to really take care of your spine as far as learning how to stretch it right, how to get core strength. And also what we want to try to work with employees on site is to make sure that they're also doing their job correctly, understanding this simple activity is giving you more of your stress than actually doing a lift. Like just doing this reaching forward is probably harder on you, or sitting all day is harder on you than doing a lift. So those are some education points that we really want to give your employees. So those are some common misconceptions. If you have more questions about that, if you want more of a detailed presentation on kind of some misconceptions about back pain, let me know. My name is Dr. Brad Conder. My email is brad at onsitefocusphysiotherapy.com, and my phone number is 502-509-3136. You can give me a call. You can give me a text, and be more than happy to talk more to you about these things. And if you want to learn more, just get a hold of us. We'll take care of you. Hope to hear from you soon, and be safe.